How would you feel if you wanted to get excellent health care, but because you were who you were, your health care was lessened or your price was raised? You probably would not appreciate it, and neither do those who experience it every single day. Elizabeth Holmes once stated, fundamentally, the answers to our challenges in health care relies on engaging and empowering the individual. Our healthcare system needs to change to make it more equal for everyone. According to a journal article written by Dr. Alba Metzger and Sorkin, discrimination occurs through all healthcare systems. As a result of being a certain gender type or having a specific racial or ethnic background, a patient could receive lower quality of treatment. Survey results showed that 2.6% of whites said that they had experienced some sort of discrimination. African Americans were at 13.1% and Hispanics at 13.4%. I chose the injustice of discrimination in the medical field because even though I've not yet experienced it, it occurs every day and everywhere. The discrimination involves gender, race, and ethnicity, and it should be eliminated from our society. All over the world, women have had the issue of gender discrimination in the medical field. It has been shown that for years, many women have had to pay a higher price for health coverage. Women on average are more likely to be covered by health, but have to pay a higher price. Business Insurance published a survey that was conducted in 2013 and had around 2,842 participants over the differences between men, women, and health insurance. The results were that 86% of women on average were insured, while only 74% of men were. Women paid around 13% more for coverage, and the deductible for a woman were 31% higher. The average deductible for a woman was around $1,614, and the man's was around $1,318. The average out-of-pocket max for a female was $2,668, and for the man it was around $2,413. Another side of discrimination that occurs in our healthcare system is the practice of racial and ethnicity discrimination. Many patients and families of patients who are in the minority group for their racial and ethnicity background have found that they are treated much different than those who are in the not in the minority grouping. Sometimes the person who is treating the patient differently are not even aware that they are doing so. A study that was published on Think Progress found that around 2/3 of all primary care doctors showed at least some sort of biased behavior toward their patients of a minority background. This results in the doctors spending less time with those patients and giving them less quality of care. If a patient with a minority background were to need emergency care or surgery, they were less likely to receive access and more likely to be sent to a place that was understaffed or had less experience. Now that I have described the discrimination, let me share a short story that involved the discrimination of race and ethnicity. Tanya Battle had been an employee at Hurley Medical Center in Flint, Michigan for around 25 years and was a neonatal intensive care nurse. Battle was assigned to a particular case, and when the father of the newborn found out that she was in her care, it all went south. And it prompted Battle to sue the hospital for emotional stress, mental anguish, humiliation, and damage to her nursing reputation. When the father found out she was caring for his infant, he asked to speak with her supervisor, and at the time they could only find the charge nurse, who later informed Battle that the man was requesting that no African Americans treat his infant. When the supervisor was informed, they told the charge nurse that to grant the wish, and then the hospital lawyer came back later saying that it was not allowed, and they told the father. But the practice of not allowing African Americans to treat the infant continued throughout the stay. Now that there's a deeper understanding of the discrimination that occurs in our healthcare system, let me share with you solutions to help dispose of the issue. In 2010, the Patient Protection and Affordable Care Act, or Obamacare, was passed with the intention to help with the discrimination issues. It was supposed to make sure that insurance companies charge the same price for both men and women. In 2012, Kathleen Sebelius, the Secretary of Health and Human Service, stated that all care plans that related to health had to provide adequate coverage for all medications for both genders that were approved by the FDA. In the year 2005, the RWJF, or Robert Wood Johnson Foundation, was launched to initiate the Reducing and Ending of Discrimination. They launched Finding Answers Disparities Research for Change to help create, encourage, and evaluate new ideas to help with the issue of discrimination. With the issues that has continued to stay around, it is important for everyone to try and help the best they can to eliminate the issue. You could talk to the person and ask for them to stop and for an apology, ask the management for a new policy or for a staff training to be put in place, or form a lawsuit. Before you do any action, you should clarify that it was discrimination that was being done. If you decide to make a complaint, the informal complaint would be your first action, and it would be talking to the specific person or organization. If that didn't work, you would then go on to make a formal complaint, which is following the hospital's or office's complaint procedure. You could then decide to incorporate an alternative dispute resolution to help find a solution when talking to the other person. Or if you feel that money is a good way to help with the issue, you could find a lawyer and file a lawsuit against the specific person or business place. You could also report to the Equality and Human Rights Commission to gain help in reporting the discrimination issue. Throughout the years, when healthcare has been involved in everyday life, discrimination involving gender, race, and ethnicity has been a big issue. Whether it's paying more for health coverage, receiving less quality of care due to discrimination by healthcare workers. In order to help with the discrimination occurrence in our healthcare system, there have been organizations and bills to help eliminate the problem. One was passed in 2010, and it was the Obamacare to help with the issue of the insurance payment and coverage. Following the bill in 2012, Kathleen Sebelius stated that all plans had to provide adequate coverage for both genders. In 2005, the RWJF was founded to help create ideas to help the issue as well. You can take steps to help eliminate the issue by making a complaint, talking it out, or filing a lawsuit. Thank you for listening to my speech over discrimination in the medical field. John Roberts once said the way to stop discrimination on the basis of race is to just stop discriminating on the basis of